Hi, we're Group G, and we're doing hip adduction and abduction, or abduction and adduction. I'm Scott McFarland.
I'm Stephen Lowry.
And I'm Tyler Gill.
So with hip adduction and abduction, there's a couple different body parts that we need to be aware of so that we can analyze the movement. First is going to be the femur, right here in his thigh. We need to be watching his pelvis or his pelvic girdle, which is going to be comprised of two separate os coxa here at his hips. And then also, Stephen, if you'll turn around, there's going to be a little bit of movement in the spine, particularly in the sacrolumbar region. Okay? So, first of all, abduction is taking the segment away from midline. So we have Stefan's midline here, and he's pulling his leg out. This is abducting or abducting. And then you have adduction, which is bringing it back to the midline. And so this is Stefan abducting his leg. So with that, there's going to be a lot of musculature that's involved. So we're just going to cover some of that before we get into other movements. But anytime we abduct and move it back, or adduct and move it back to midline, we're going to be using a lot of muscles on the inside of our legs here. So you have an adductor brevis, an adductor longus, and an adductor magnus. There's also the pectineus and the gracilis, which are inside here. When we abduct or take the leg away, we're going to use muscles on the exterior or the lateral side of our body. So we have our glute muscles. There's a medius, a minimus, and a maximus. And then there's also the tensor fasciae latae and the sartorius, which are going to assist in that as well.
Here we are demonstrating adduction, which is bringing it towards the midline. His right leg is adducting. It's going to be a left pelvic tilt and a right spinal lateral flexion. We'll come demonstrate it on the other side. It's going to be his left leg is adducting, going towards the midline. It's going to be a right pelvic tilt and a left spinal lateral flexion. Now all these movements here happen in the frontal plane, as well as the pelvic tilt happens on the anterior posterior axis. The muscles involved include the adductors. They're going to be the most important ones in here. It's going to be your adductor longus, magnus, and brevis, as well as the pectineus and gracilis help in this motion as well.
Okay, Scott is demonstrating abduction of the femur. So when he performs the abduction, there is a right lateral flexion of the spine and a left lateral tilt of the pelvis. So if we demonstrate that on the opposite side, so a right abduction of the femur, there's a left lateral flexion of the spine and a left lateral tilt of the pelvis. The muscles involved in abduction is your gluteus medius and your gluteus minimus and your tensor fasciae latae. Planes of motion are just like the adduction, so there's frontal plane, and your pelvis is rotating on that AP axis.
So the last thing we want to cover is the type of contractions that happen through these movements of abduction and adduction. So remember, with all the muscles that we went through, the gluteuses, the adductors, as well as the other supporting muscles, you're going to be using those muscles on both sides no matter which movement you use, but there's going to be different types of contractions. So Stefan, right now he's abducting his left side. So right now, his abductors on the left side, his abductors on the left side over here, the gluteus minimus and medius and tensor fasciae latae, those are acting concentrically. They're shortening and generating force. Now the antagonist muscles on that same side are going to be the ones that are responsible for our adduction, and they're acting eccentrically right now. They're lengthening while stabilizing the leg. On the opposite side is the same antagonist muscles, but on the opposite side, they're acting isometrically, where they're stabilizing that opposite hip, and so they're tense, but they're not lengthening or shortening. Now, if you were to switch sides and abduct his right, The right side glutes are going to be acting concentrically, where they're shortening and generating the force. And on the opposite side, his glutes, the same antagonist muscles, are going to be operating isometrically, meaning not lengthening or shortening, but tensing to create stability. And the antagonist muscles on the opposite side are going to be acting eccentrically, where they're lengthening, but firing or stabilizing his other leg. Now, if we were to talk about adduction, where we're bringing it back in, same muscle groups, opposite reactions. So Stefan is adducting his left side, so his adductors are acting concentrically, meaning they're bringing it back in, they're shortening and generating force. On the opposite side, the agonist muscles, which are again the adductors, same thing as the other side, these are acting eccentrically, where they're tensing and generating stability, but they're lengthening as it happens. And then his antagonist muscles on the opposite side are acting isometrically, where they're tensing, but they're not lengthening or shortening. So the last thing we want to talk about is the type of contraction that's going to exist with both our adduction, or abduction, and our adduction. There's three different types of contractions. There's concentric, eccentric, and isometric. We're going to see all three. So when Stefan abducts or abducts his leg, his abductors, which are the gluteus minimus and medius and the tensor fasciae latae, those are acting concentrically. While these are acting concentrically, on the opposite side, here on his left, his gluteus medius and minimus, which are concentric on this side, are isometric on this side, meaning they're tensing, but they're not lengthening or shortening. And his adductors on this side are acting eccentrically, meaning they're creating stability, but they're lengthening as they do that. Now, if we come back to the right and we adduct, which is bringing it back in, again, we're going to see all three. His adductors are creating force and moving the limb, and they're shortening, so they're acting concentrically. Whereas on the opposite side, his adductors here are acting eccentrically, where they're lengthening but creating force, and his glutes and his tensor fasciae latae is acting isometrically, where they're stabilizing and not generating any